I think we're excited mostly for our patients and the families that spend time here.
Well, what excites me most about doing these big projects is looking back over the years and seeing all the buildings I've completed. I take a lot of pride in my work.
I feel that having a clinical background, I understand what the users might be trying to explain from the design, getting to the construction phase, and then operationally, how do they work in it when they move here? This is a pretty large project, and there's a lot of players.
My role is taking care and making sure that we get all the clinical technology purchased, installed, and set up and ready to go. We have probably over 27,000 individual pieces of equipment, and the MRIs, the CTs, the IR rooms, the NIR rooms, everything, from EKG machines to ultrasounds and things of that nature.
IT does get involved early on with the architecture and the engineering team. It's a lot of design, a lot of plans for redundancy. We want to ensure the infrastructure stays up at all times. We work with them to ensure all the power's in the right spots, the data's in the right spots. My equipment left for the tower, it's a little over 13,000 items. Installing the PCs, it's a big process. We do have to plan for the order, receive all the equipment, we image the equipment, getting all the PCs installed and in the right spots and with the right software. And then after all that is the most important part. Doing the epic testing, the technical dress rehearsals is definitely one of the key steps to make sure everything's going to function right.
We took a period of time for 5 years to get to this point. Just on the other side of the floor, we already have train the trainers in the building. That's part of activation. Activation is getting this building operational. When they do the train the trainers currently, they are out there logging each and every individual who is going through, and frontline staff will be out learning life safety, learning how to use lifts, learning how to use the monitors, so that we have documentation later on that we can show that we've sent people through. The state reviewers will come in early September. They are nursing surveyors who will come to the floors to make sure that you're ready for a patient the very next day they walk out. So for food services, the state has gone through there from a construction standpoint, but also the city health department comes through. There's a cleaning regimen, there are airflow reports that we have to turn in. So a very rigid and strict checklist that is looked at before they say, yes, you're good to open for medication handling. As far as signage and being part of activation of the building, there's a lot of stages to signage and there's lots of different types. So we work with the compliance team here at BJH and have already walked the building with Lisa Wilson. They will come through the floors, put artwork in the hallways as you walk down the hall, and then we have graphics in each of the patient rooms to give color so that it's not too sterile looking. Now we're going down the list saying, do you have this done? Is this done?
We really are going to be working very closely with our surgical colleagues. I think, having all of the patients that we care for together in a similar facility is going to be really nice for patient care, collaboration, and then really delivering state-of-the-art care like we do every day. But in a place like this, it really matches the kind of care that we deliver to have a space like this.
This is a beautiful building, and we want every patient that comes to this tower to have a very, and I do mean exceptional experience, because it is pretty exceptional. And the people who provide the care now have the tools to make that care that exceptional piece.